Hi everyone, and thank you for joining our second episode of Community Matters, a new broadcast connecting the team at Croakey Health Media with our diverse communities across Australia. My name is Dr Janine Mohamed and I'm a proud Narungagana woman, but I'm speaking with you today wearing one of my many hats as the chair of Croakey Health Media, a non-profit journalism organisation that focuses on health equity and the wider determinants of health. I'd like to begin by acknowledging the traditional custodians of the country where I'm broadcasting from, which is the Wurundjeri peoples of the Kulin Nation. I also acknowledge First Nations where you are watching from today, and I encourage non-Indigenous viewers to reflect upon the country where you are right now and the long history of First Nations people in caring for their countries and their communities. On that note, it was really good to see my deadly cousin, Professor James Ward, writing for Croakey recently. James is the only Aboriginal member of the Communicable Diseases Network of Australia and is also a member of the Aboriginal Torres Strait Islander Advisory Group with the CDNA. His in-depth article outlined the many actions underway to protect Aboriginal Torres Strait Islander communities from the novel coronavirus. James, Pitnanjara Narungga man and the Director of Posh Centre for Indigenous Health at University of Queensland, also paid tribute to the innovative work of NACCHO and the Aboriginal community-controlled health organisations. He wrote, "The sector is built on history and legacy. It demonstrates resilience and in true fashion has already been conducting an enormous amount of work, developing communication campaigns, innovative thinking and service delivery, as well as leadership and advocacy, while also at the same time demonstrating committed care to their clients." James also spoke of the importance of ensuring that messaging to communities is firm, clear, consistent and optimistic. One of the worrying messages we are starting to hear from our communities is that some of the responses to the pandemic are dangerous for our people, especially the trend of punitive policing and law enforcement, when really what we need is not a regulatory response or a disaster response, but a public health response. So it was really good to see the Victorian Aboriginal Legal Service recently speaking up and clearly and firmly outlining the need to ensure the pandemic response does not lead to more Aboriginal people in the criminal justice system or more Aboriginal children being removed from their families and culture. BOWS also called for greater efforts to ensure that Aboriginal people in the criminal, youth justice and child protection systems are not disproportionately impacted by the pandemic. So I'm really pleased to report that there is some good news in this space. The Victorian government recently announced a $77.5 million package to help address pandemic concerns for children. I have with me the Victorian Commissioner for Aboriginal Children and Young People, Mr Justin Mohamed, who also happens to be my husband, and who's going to tell us a little bit about the package. Justin, I know you've welcomed this package, but what's the difference that it's actually going to make for our mob?
Thanks, Janine. This package is the $77.4 million. Comes with a great lot of focus, particularly on the out-of-home care space. So a number of children, and we know Aboriginal children are well overrepresented in this space, out-of-home care. And in these times when pandemics like this, we know that vulnerable children don't have the focus and the spotlight on them because things are restricted. The service providers are restricted for the sort of services they would normally do. Children are more confined and sometimes are isolated, and sometimes they aren't in the best places, and so they don't have their normal support structures around them have been disrupted, which this is what this the COVID-19 has done. So the 77.5, I should say, has come in to support in this space of out-of-home care a number of different areas. One, it is for the carers. There's each carer, and that includes foster carers as well as kinship carers will be receiving payments, additional payments for every child that they're looking after. So that should help internally inside the household. As well as then we have a number of our children which are in residential centres, which is pretty difficult because there is all the restriction and closing and making sure that they're isolated, and what happens if someone gets sick, and what happens to the other children. So there's an injection of this, part of these funds are going to support the residential centres, so they don't have to close the doors. They're going to keep opening and keep looking after young people that are in those centres. There's a raft of different supports, but there are a couple of the bigger ones, as well as the other part, which I think is going to be very, it's very important, which people forget. So young people, when they turn 18, and then many of them, they're in out of home care and child protection. Once they're 18, then they get cut from, and they have to then move on with their lives, which, you know, personally and as a commissioner and a commissioner of children and young people, we believe they need to have way more support beyond 18. But that's the way the system is. There's a little bit of support in the state for some of these young people, but the government in this package has announced that every young person who turns 18 from the 1st of April this year through to December, wherever they are placed will be supported beyond their 18th birthday. So that's a very big sort of step in the right direction.
Absolutely.
So yeah, the package itself covers that, as well as also looking at what we can learn from this, how we can probably support and the systemic changes that need to be done. And this pandemic has caused a lot of thinking, a lot of internal looking, and saying, well, how can we do this better to look after our most vulnerable young people across the state of Victoria.
Thank you, Justin. A very welcome package, I'm sure, by carers and families looking after our kids, and those centres looking after our, our kids in residential care. Yeah,
it is good. We know that the out-of-home care space, child protection, is a pretty difficult space. It doesn't always go high on any political campaigning or in the government sort of telling everyone what a great job they're doing. So it's good to see that our young people that are in pretty tough situations, that this pandemic doesn't cause more trauma and more hardships that they've already have faced in their early lives.
Yeah.
So it's been good.
Great. Thanks for your time, Justin.
Thank you.
I'm now going to wrap up with some more good news. Croakey is beginning a new project to investigate the health issues for prisoners and their families during the pandemic. We are able to do this because we've just won a grant for freelance journalists, and that's from the Judith Nelson Institute for Journalism and Ideas. I'd like to acknowledge and thank the Institute for their support of our work. As a part of this project, we are going to be sharing news and resources using the hashtag #JusticeCovid. So please contact us if you've got any ideas for stories, and thank you for tuning in, and we'll see you next time.